But fundamentally, the purpose of a good, efficient health service is to save us and protect us. It is not our duty as citizens to save the health service.
Really? Save the NHS is what we're hearing
Yeah,
about.
well, that's inverting what's supposed to happen, isn't it? The NHS exists to save me. If I am healthy,
wow, that's a good point.
If I have not committed a crime, who does the government think it is to put me under house arrest? We would never accept that for anything else. Why did we accept it for this? This was the most serious invasion and curtailment of individual rights and freedoms in Australia in our history, much more so than they did even in wartime. And this idea that we did very well, excuse me. We had these lockdowns throughout the country. We waited till we have vaccines, then we begin to open up. The critics always said that what this does is defers this, throws the can down, kicks the can down the road, defers the cost. The result is you come to 2022, because you have built up this so-called immunity debt, because you haven't exposed your population to regular circulating pathogens, when you do open up, you suddenly have a death per capita that is amongst the highest in the world in 2022. Did you realize that? Australia, yes.
Yeah. Australia has the highest death per capita.
Yes. During some weeks, it's almost 30% above the norm for 2015 to 2019 in Australia. So right now, what you're seeing in Australia is exactly the toll of these lockdowns paid now. Of course, COVID is all spread all through Australia. Has more cases of COVID per capita through the pandemic than the United States and Europe.
Per capita.
Well, we do love our credit cards in Australia. That's basically what we've done.
Yeah, I mean, and so you asked me earlier about did you save lives? I don't think so. I think what's happened is you have cost the Australian people's lives by paying the harms of the lockdown and also paying the harms of COVID.